I'm delighted to be here this morning to observe the 2017 World Day for Safety and Health at Work. And I want you to know that in Parliament this week I've been telling everybody that today is going to be World OHS Day. We've already started the publicity of this day in Parliament, and I intend to be doing that again today. I would like to acknowledge and commend the ILO for its continuing efforts in promoting the World Day for Safety and Health at Work. This year's theme for World Day for Safety and Health at Work is optimize the collection and use of OSH data. ILO's campaign for this year's World Day for Safety and Health focuses on the critical need for countries to improve their capacity to collect and utilize reliable OSH data. I understand that the theme contributes to the implementation of SDG 8, which deals with inclusive and sustainable economic growth, full and productive employment, and decent work for all, something that the ministry strives to do. Target 8.8 in particular focuses on the protection of labor rights and promotion of safe and secure working environments for all workers. And countries are asked to report on the frequency rates of fatal and non-fatal occupational injuries to workers. Ladies and gentlemen, World Day for Safety and Health at Work is an awareness-raising campaign intended to focus on the critical need for countries to improve their capacity to collect and utilize occupational safety and health data. This day serves as a reminder to us all on our responsibilities as employers and as employees. The Ministry, with the support of the tripartite partners and the ILO, would like to collectively put a challenge to all present here today to mark this very important day with the aim of improving the reporting of fatal and non-fatal accidents by, first, ensuring that there are proper reporting systems for reporting all accidents in the workplaces, and workers and management are aware of the processes involved. Secondly, to develop processes for reporting of incidents and near misses, as they will assist in the identification of hazards and timely initiation of preventative measures to prevent or reduce workplace accidents. It is vitally important that the information you retrieve is accurate and relevant. For information to be accurate, it must be reliable, valid, and current. It must also be complete with no gaps that would affect its accuracy. We must at all times endure to obtain the most reliable and valid data, which in turn generates up-to-date reports and claims. When we speak of reliable and valid, it is appropriate for us to know that reliability refers to the consistency of any repeated information, while validity addresses whether the information or the measure actually addresses what it is intended to measure. Reliability may be affected by factors such as sample size or the period over which information is collected. For some information, such as occurrence statistics, data must be collected over a period of time to obtain reliable information. The use of positive or lead indicators to measure health and safety performance is an increasing trend in health and safety management. They are useful as performance drivers as they measure the activities that drive good health and safety performance. However, they are also an example of the importance of evaluating reliability and validity. In storing information, it is important to remember that information is being stored so that it can be used. It is important not to create data cemeteries where the data dies. Therefore, when deciding how to store information, keep in mind why the information is being stored, who will want to use it, when and how often they will want to access the information, what protections are required for the information, what links or other factors need to be considered for the data to be meaningful. My ministry collects data for fatal and non-fatal injuries and data and death via the official reporting done on the OHS and workmen's compensation forms. The information received on these forms is then entered into a database by individual officers in all the ministry offices around the country. The collation of this data enables the ministry to identify areas that need workplace training and awareness and target high-risk employees and develop strategies to reduce accidents. Apart from the above, my ministry also collects data on hazards, incident reports, and injury and illness reports, workers' compensation claims reports, and other compensation details, investigation reports, and workplace inspections, records of workplace hygiene monitoring and exposure level records, minutes of meetings for health and safety committees, risk assessment reports and audits, including enforcement notices and actions, related information such as trend analysis of incident and injury reports, safety data sheets for hazardous chemicals and hazardous substances, chemical registers, documentation related to registered plants and equipment and machinery, training records and information related to performance measures for health and safety management process. My ministry continues to work with all our stakeholders, such as employers, workers, and government ministries and departments, to ensure that we all strive to reduce accidents in the workplace. However, some of the challenges in having reliable and accurate OSH data are procedures for recording and reporting of injuries and fatalities by government bodies, insurance companies, and health facilities, resulting in discrepancy in data collected, late reporting of injuries and fatalities years after it occurs, reluctance to report immediately, or the use of delaying tactics in terms of awaiting medical reports, determining whether a case reported is compensable, delay in reporting or any omission to witness the appropriate treatment and compensation of injured or deceased workers. ILO 2017 current estimates show that work-related accidents causing injuries is $313 billion. Work-related accidents around the world, 350,000. Occupational and work-related fatal diseases, 2 million. Work-related deaths, 2.35 million. Lost GDP on occupational accidents and disease, 4% of GDP globally, and I suppose we can see that to be 4% also for Fiji. Representatives from government, industry, and employers and workers' organizations should actively participate and promote better reporting of fatal and non-fatal injuries, and doing so will better assist government to facilitate resources to identify areas of need. Finally, I wish to acknowledge the important role of the tripartite Occupational Health and Safety Advisory Board that encourages dialogue and consensus on matters relating to and in creating safe and healthy workplaces in Fiji. For the program participants, I sincerely hope that you will enjoy the training that will be provided today. Our challenge after this is to help you to put together strategies that will help in the better collection of and data collation to create safe and healthy workplaces in Fiji. With these words, ladies and gentlemen, I, on behalf of the Fijian government, wish you all the very best towards making this notable day in our working lives, a World Day for Safety and Health at Work, a very fruitful learning experience, and I now have much pleasure in opening this workshop. Ladies and gentlemen, let us support promoting safety and healthy in a collective way. Thank you.